Okay, this video is about excitotoxicity lecture, and this person here is Dr. Russell Blaylock. He's a neurosurgeon. He's also a nutrition expert, and I'm just going to link to his lecture below. I'm not going to go into a lot of technical detail right at this moment, but if you're interested in the brain, if you're interested in prevention of dementia and optimizing cognitive function, you're going to find this lecture very interesting. He did a great job with his lecture. It's kind of an old lecture. It's about 12 years old. But there's things you can see in this lecture. You know, Russell Blaylock is a very smart guy. He's also a Christian. He's willing to talk about unpopular subjects. There is no reward for talking about unpopular things, for pointing out bad things that industry is doing. So it takes a lot of courage. Also, it takes a lot of knowledge because industry is not going to be happy about it, so you better get your facts straight. There's always a chance you're going to get hassled by the MSG industry, for example. Excitotoxicity is probably the most important topic in all of neuroscience. This and the dilatory theory. Okay, but you can barely find it in any of the textbooks. In the so-called world of neurology, neuroradiology, internal medicine, I never once heard it mentioned. I only heard about it when I started to read more in the nutrition literature, and then I came across the papers of Dr. Blaylock and the book of Dr. Blaylock. We'll talk about that some other time, but I just wanted you to see a great lecture and sort of everything that goes into it. Because, you know, it's been said that, you know, Cicero said this, a great orator should be somewhat of a hero, because you have to be. You have to have your act together. You have to know what you're talking about. You have to be brave. You know, look at Jeff Nelson when he talks. Look at Dr. McDougall when he talks. Look at T. Colin Campbell. Look at Caldwell Esselstyn, okay? You have to be iconoclastic. You have to have your act together. You have to have your knowledge together to make it work, okay? And so, let's see, what else? His father died from Parkinson's disease, and he was kind of sad about that. And his father also had some symptoms of ALS, which kind of makes the point that Parkinson's disease can sometimes go with ALS. Obviously, Parkinson's is much more common than ALS. ALS is pretty rare. And also, Alzheimer's type dementia can go with Parkinson's. A lot of times, about 30% of Parkinson's patients are demented in that ballpark. And one of the points that's made is that all three can go together. Dementia, Parkinson's, and ALS. And some of that might be due to them having, at least in part, a common causative mechanism with this excitotoxicity stuff. This lecture is about 12 years old. I'm going to link to it below. Sometimes the lighting is poor. Some of the slides are illegible, but still the brilliance and goodness of Blaylock shines through, and that's what makes it worth seeing. And when you hear his point of view, he'll give a good historical information and whatnot. Then when you watch other lectures that I've made and videos I've made in the past about it, it'll sort of fill in some of the gaps on it. So anyways, Dr. Russell Blaylock, an extraordinary lecture on excitotoxicity.